Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today my video will be about the rubber dam. This is a special made video for one of my followers. She asked me to do a video for the rubber dam. And for people who are new to the channel, make sure to subscribe down below for more and more similar videos. So let's start now. Rubber dam is a thin 6-inch square sheet, usually made up of either latex or nitrile. So for patients that are allergic to latex, we can replace it with nitrile. It is used in dentistry to isolate the operative site in which either single tooth or more than one tooth isolation is necessary from the rest of the mouth. Not only in operative dentistry will use the rubber dam, we can use it also for endodontic procedures. Why is that? Because of the risk of high sodium hypochlorite accident. Now, the rubber dam is indicated for all patients without exceptions, except the ones that I will say right now. So it is contraindicated for patients who are claustrophobic. They cannot tolerate to have anything placed on their face. Second, who suffer from severe asthma. If they have asthma and it's under control, you can place rubber dam. But if they have severe asthma and it's not under control, then you should never place for them a rubber dam. Third, they have trouble breathing through their nose, who are the mouth breathers, who breathe through their mouth rather than through their nose. You cannot place a rubber dam for them. Other contraindications include patients with teeth that are not fully erupted, like in case of third molar that is partially erupted, you can never place a rubber dam there. And patients who cannot tolerate the clamp without anesthesia, and this is commonly seen in children, they cannot tolerate to place a clamp on inside their mouth. So that's why we need to place and give anesthesia. Which type of anesthesia? You give them intraligamentary anesthesia in order to tolerate the presence of clamp in their mouth. Now, what is the armamentarium that is needed for the rubber dam placement? Number one, of course, you need to have the rubber dam sheet. It's obvious. Second, a clamp that will be fixed on the tooth or hook. Third, frame. Of course, it's required. Forceps, dam punch, dental floss. All these are required for the placement of the rubber dam. Without them, you can never place a rubber dam, right? So here is the picture for the rubber dam sheet. It can be either made up of latex or nitrile. For patients who are allergic to latex, there is a second option for them to go for nitrile. Now, if you are concerned about the photography and everything, it's better to choose a rubber dam sheet that is light blue color for better picture details. Next is the rubber dam frame. You need to place a frame in order to stabilize the sheet onto the patient's mouth. Then we have the clamp holder. Of course, you need to have forceps to hold the clamp in order to position it to where you need. Next is rubber dam punch that is used to make the holes in the sheet through which the teeth can be isolated. Within the rubber dam punch, it has 6 holes. Each hole is indicated for a certain tooth or teeth. The largest hole, of course, obviously it is indicated for the large tooth, that is the molar. Next is the 2 others, they are indicated for either molars or premolars. And next is the one in the middle, that is the 6 o'clock position. It is indicated for the canines or also can be indicated for the anteriors. You can use it, no worries. And then we have the other one, it is indicated for the upper anteriors, and the smallest hole is indicated for the lower anteriors. Remember, the smallest hole is indicated for the lower anteriors, whereas the largest hole is indicated for the molars. And here is the picture for the rubber dam clumps. And you can see that each clump has a code or a number that is written on the top. And this number represents the tooth in which you can place the clump on. For instance, clump number 2 is indicated for the premolars. Clump number 8 is indicated for the upper molar. Clump number 7 is indicated for the lower molar. Can you place it for the upper molar? Yes, in some cases, the clumps, they can be combined and you can use it in multiple teeth. You can try the clumps, but don't place clump number 7 for the anterior. It is indicated for the molar, so you will place it for the molar, either the upper molar or the lower molar, but don't place it on the premolar or the anterior, because the clump is very large to be placed on, right? And there is also an important clamp, that is the B4 clamp. This B4 clamp is only used in operative procedures. It will not be used in endo procedures. It aids in isolation by retracting the tissue without harming surrounding gingival tissue. Like for instance, in this picture, the doctor is doing class 4 restoration. So in case of class 4, you can stabilize the rubber dam in place by placing a B4 clamp. And at the same time, the B4 clamp, when you place inside the patient's mouth, you don't need to give anesthesia because it will not cause any pain for the patient. Now, can we use the clamps for the primary teeth? Yes, of course. And the clamps for the primary teeth, they are denoted by the A. When you see letter A means it's for primary teeth. Now, the most commonly used clamps are, number 1 is 12A clamp. 12A is indicated for the maxillary left second primary molar and the mandibular right second primary molar. 13A, maxillary right second primary molar and the mandibular left primary second molar. So it is all molars. 2A, indicated for first primary molar. 14 clamp for fully erupted permanent molar, and 14A for partially erupted permanent molar. I said that when you see the letter A indicated for primary teeth. If not primary teeth, then it will be partially erupted teeth. If partially erupted, it will also be denoted by the code A or letter A. Now, these are the clamps that will be used for the front teeth. These are the only ones. Don't place clamp number 7 or clamp number 2 on the front teeth. Always the butterfly clamps, they are placed for the front teeth, which are number 6, 9, 90, 212, and 15. And the most commonly used one is the clamp number 212. We have two types of clamp. We have wing clamp and we have wingless clamp. The wing clamp is commonly used for the molars, whereas the wingless clamp is used for the anteriors together with the premolars, also can be used, such as the clamp B4 can be used for the premolar as well, not only in the anterior. So clamp with wings are those that have a small outer rim through which the rubber dam can be positioned extraorally and thus be carried together with the clamp all in one about the patient. So the wing clamp, you can place it on the rubber dam sheet and carry it all together inside the patient's mouth. Whereas the clamp without wings, or also referred to as the wingless clamp, the clamps are first, you will first place the clamp on the tooth and then bring the sheet and stabilize the sheet onto the clamp. So here is the full armamentarium that should be brought in order to place a rubber dam for the patient. And don't forget, there is dental floss that you need to bring in order to place a floss on the rubber dam, because in some cases, the clamp might fall into the inside the patient's mouth and the patient might, by mistake, aspirate, and so there is a high risk of aspiration of the clump. So therefore, we need to place a floss on the clump for easy retrieval. And there's also another thing you can see on in the picture. There is a box that is yellow color, white and yellow. The yellow one is referred to as the widget. What is widget? The widget is used in order to separate the teeth. If the teeth basically they are heavily or tightly in contact with one another, in order to separate them, in order to allow for the placement of the rubber dam, we need to place a widget in between them. Not only that, there's other indication for the widget. For the upper anterior area, if you want to place the rubber dam without clumps, you can stabilize the rubber dam without clumps by the widget. So this is also another indication for the widget. Now, when you bring a rubber dam, you can see that it has two surfaces. It has a dull side and it has a shiny side. The dull side is the one that will face the occlusal surface of the tooth. The shiny side will be facing you. Next is the rubber dam template. You need to locate the teeth. Where is the position of the teeth? So here you will have a template in order to mark on the sheet exactly which tooth you will be working on in order to punch it on the right place. So here is a picture for the dental floss that is tightened very good into the clamp. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below, comment down below if you have any questions, and subscribe for more videos. Goodbye now.